So welcome everybody. The long COVID, as the unprecedented pandemic is now called today, has wreaked havoc in the lives of everyone around us. Even though 944 million people across the world have now been vaccinated, countries are reeling under a second, third, and potentially even a fourth resurgence. The moot question, therefore, is, will the impact of the long COVID outlast the pandemic? We have with us today Dr. Gopalakrishnan, Senior Consultant, Institute of Infectious Diseases, Apollo Hospitals, Chennai, an expert of over 3 decades and a dear friend of mine, to share his perspectives on this most talked about subject. I would request all of you to Google him and you will understand his entire medical background. Welcome, Dr. Ram. First of all, I would like to thank you and congratulate the entire medical fraternity on the selfless service that you are all rendering for everyone else's life before yours or your families. Without much ado, let me dive into the questions I have, and you may then have to take questions from the audience. I sincerely appreciate the fact that in spite of the fact that you need to be in the ICU at this point in time, like you told me earlier, you've actually chosen to sit in one place so that the Wi-Fi is not disturbed. And from NASCOM, we thank you from the bottom of our hearts. Thank you. So my first question is the following. We thought that India had handled the first round last year quite admirably, till the second wave hit the nation a month ago. How serious is it? And why do you think the second wave has spread so quickly?
Yeah, so thank you very much for Keshav for that generous invitation and introduction. So yes, we are in the middle of a second wave. Why do you think it's hit us so hard? Partly because we were not prepared. When I say we, I include the entire scientific community, not just India, not just the Indian medical profession, but the entire scientific community, the public health community, the government, the health sector was not adequately prepared for a second wave. And perhaps they could not have prepared any better than they did. It just was one of those things which hit us hard by surprise. We had much more time to prepare for the first wave. Essentially, it was an imported virus. So we had a lot of time to work things out, even though the science behind the virus was not so clear. The science behind the virus is pretty clear right now. But the fact that it's come back is really a big issue. And as this program goes on, I'll tell you why this wave is going to be as destructive, if not more destructive than last year. That is unfortunately the truth. But there's a lot of things we can do to mitigate this wave, which we will discuss.
Sure, Gopal. So with new mutants now being spoken about every week, and we just heard about a new Bengal variant as a third one, can you now comment on the effectiveness of vaccines?
Yeah, so that's actually $1 million question. And the true answer to that is nobody knows. Now, best guesses think that the vaccines we have currently available, both in India and abroad, will prevent severe disease due to the new mutants. In other words, if you get infected 2 weeks after your second dose, which is what a full proper vaccination course constitutes, you will not end up in the hospital, you will not end up on the ventilator, and you will not die. But you will have mild to moderate disease, which is certainly far better than dying of a deadly infection. The problem is when you have mild to moderate disease, you will spread the infection. So there is a high chance that we will see as many cases, if not more, compared to last year. But hopefully, if we can roll out vaccine to adequate numbers of the population, we will not see as high a mortality or a complete choking of the healthcare system, which is what we are in danger of right now.
Okay, so when should a patient who has symptoms actually go to a hospital, and how should they manage at home? Also, I just want to ask your views on things we keep reading about: steam inhalation, vitamin C, and many home remedies. Are they actually useful?
Yeah, so the approach to COVID is a little bit based upon the patient's age and risk factors. For instance, if you are above the age of 60 and you have a lot of other medical ailments like heart disease, diabetes, etc., you need to contact your doctor right away. You need not have to go into a hospital. It could just be an electronic contact, but you need to contact somebody right away because those are the folks who are at maximum risk of getting bad. On the other hand, if you are under the age of 60, then your chances of getting worse are lower. And most of the time, the vast majority of the time, COVID behaves as a mild to moderate disease, which can be taken care of at home. So the kids actually have the least problems with COVID. It comes and it goes just like, a traditional cold. So the people who are middle-aged, who are somewhere in between, need to contact the doctors, but at the most to get a home treatment protocol. The vast majority of cases can be handled at home. But in general, if you test positive or you suspect you have COVID, contact your doctor. You need not have to go into the hospital, but contact your doctor in his clinic or online, whatever works for you.
And anything on the home remedies?
Well, Keshav, if there are a lot of home remedies, it means that none of them really work. So this is natural when you have a new virus, which is unknown to science, which causes a lot of infections, causes a lot of death. People tend to use whatever, it's like clutching at straws, really. So the problem is for us in the scientific community to say that something works and use it, it has to be based by proper evidence. And there is absolutely no evidence that things like steam inhalation or so many other things that you can come up with on the net work for COVID. The only thing that really helps with COVID for mild to moderate disease is good old paracetamol. Just take a lot of paracetamol, drink plenty of fluids, and stay at home. In people who are at higher risk, there is a recent advance in that we can give them an inhaled steroid. This is the stuff that asthmatics use to prevent asthma. So we can give them that stuff. It's not absorbed into your body, but it just works at the local level to prevent COVID from getting worse. We have a whole bunch of treatments for COVID, which were not there last year, but these are all for seriously ill or admitted patients. So if you're a young person, you have mild disease, you're at home, there's really nothing you need other than paracetamol and perhaps an inhaler.
Excellent. Now, talking about vaccines, what do you think will be the future, of vaccines? We saw the development of this vaccine in less than a year, frankly. So it was really accelerated. And now, will this now be the norm for, vaccine, deployment and development, if you ask me? And can there be any side effects as a result?
Right. So what has happened is COVID is a moving target. Now, we didn't anticipate this when the virus came out. We thought it's a solitary target. You take a shot at it with a vaccine, you won't get it. Not like that. But actually, we were kind of foolish not to learn from the influenza example. We all know that you have influenza. H1N1 would be familiar to most of the viewers here, which causes periodic infection, caused a lot of deaths in 2009. And we know that the influenza virus mutates a little bit every year, so that the previous year's vaccines don't work against this year's virus. So we have a new influenza vaccine, which is manufactured every year, which you got to take annually. So COVID is doing exactly the same thing. It is mutating so that last year's vaccine won't recognize it. It's simple Darwinian theory, survival of the fittest. The virus that can escape the pressures of the immune system, multiplies the most. So that is why you have all these escape variants. The wild type virus, the Wuhan virus, which came out last year, is slowly coming down. These mutations are going up. So how do we respond? We respond by devising new vaccines every year. So the vaccine that you're going to see in 2022 will be a whole lot different from the vaccine we have in 2021. Unfortunately, the vaccines we have in India and the vaccines we have abroad are all based on the original Wuhan strain, which is slowly coming down. That is why you're seeing this new wave. So scientists have to get smarter and design a new vaccine and deploy it every year. So COVID is going to be exactly like the flu. When you line up for your flu shot every year, you have to take a COVID vaccine at the same time. And soon companies will come out with flu and corona vaccines in the same shot, just like kids get multiple vaccines in a single injection, which you got to take annually. This is what most experts in this area see for the future in terms of COVID. It's never going to go away. It's going to cause periodic waves, but we can mitigate those waves by aggressive annual vaccination, which is updated annually.
Thank you, Dr. Gopal. Now, in terms of vaccines again, are all vaccines as efficient in your opinion? Can you talk a little bit about the delay of doses between one vaccine and the other? And of late, we are now hearing about a potential booster dose on some vaccines. Can you comment on all of this, please?
Yeah, so we have vaccines that are available in India and those that are available in the West. For instance, the best studied vaccines, the ones that have the best trial data, and certainly the ones that have an efficacy more than 90% are the ones that are available abroad, like the Pfizer vaccine, the Moderna vaccine. Those use an entirely new technology. They are not available in India. Recently, the government announced that they plan to allow sale of these vaccines in India. The vaccines that you do have in India, the two vaccines, the Covishield and the Covaxin, have somewhat lower efficacy rates than the 90% numbers that you've had established abroad. Maybe 60%, maybe 70%, maybe 80%. With the Covishield vaccine, that is a fairly well-established number. It's well published, well researched, published in reputed journals. With the Covaxin, we expect it'll do well, but we don't know. They have not published their data in any scientific journal for us to make an independent assessment of whether it works. Most people think it should work well, but we really don't know. That is why there was some controversy when it was authorized without publishing its final data. Regardless, these are the two vaccines we have available. And right now, we are beggars. We can't be choosers. Whatever is available, please take. It was given free by the government. It still is free. It's very subsidized even in private areas. If you've not had a vaccine so far, take your shot. Now, the exact nitty-gritty, namely the number of days or the number of weeks behind your shot, is really a matter of semantics. There are pros and cons. If you look at the scientific literature, if you prolong your second dose of Covishield from 4 weeks out to about 6 to 12 weeks, you get a better take, going up to sometimes 90%. But then you may ask, if I take one shot, that's not going to protect me. What if I get infected in the second wave in between? I'm just sitting around here waiting for my second shot. If I get infected in between, isn't that foolish of me? That's a very valid argument too. So if you ask me right now, all vaccines, please take at the minimum dose interval, 4 weeks, because this new wave has changed the equation. You really don't want to go for long periods of time without finishing off both your doses.
Very, very insightful. And on the booster, any comment?
The booster is something which is theoretical. There are no studies published on it. What I foresee for the next decade or so is an annual booster shot of COVID vaccine, which is slightly different from last year. It's based upon the most recent mutants that are circulating around, so that it's expected to work the best. But this is, again, speculation. Only time will tell.
Thanks, Dr. Gopal. We have a lot of leaders here who run very important companies. So I'm just going to shift gears a little bit. And I want to ask you that as individuals and leaders of organizations, how should we better manage such onslaughts? I mean, just give us a sense of how does this virus actually spread in a work environment, and the treatment that can be most effective, while we are running, some of these offices. And what are the myths surrounding this?
Right, okay. So the first myth which has been shattered is that COVID spreads on objects, right? You can't get COVID by touching a table that somebody else has touched, or by sitting in a seat where somebody else has sat on, or by picking up, food that the Swiggy guy delivers outside your house, or by vegetables, by actually touching vegetables in a market. It does not spread on surfaces. So that is one thing we can straight away remove as a method of transmission. COVID spreads person to person, and the vast majority of spread is when people are within 2 meters from each other. It largely spreads through droplets which fall to the ground when you speak. So if you're 2 meters away from me, there's a low chance that you will actually get infected by me. So the corollary is stay 2 meters away from each other, which is why we leave alternate seats vacant, which is why we spatially separate people who are in professional interactions, etc. Now, this spatial separation will work even better if both the persons who are interacting are masked. Because when you mask, you prevent COVID that you may be carrying from coming out, and you prevent COVID that the other person is potentially carrying from coming into you. So masking is a critical element of prevention. So all companies, please don't let your employees in unless they are masked. Completely discourage removal of masks from the time they start working till the time they leave office, and encourage them to do the same after hours as well, when obviously you can't police, you have less control. That means a lot of things, and I'm sure industry is already seized of these matters. For instance, avoid group meals. If you're in a group meal, all of you take off your mask, you're relaxed, you're eating, and that's when COVID spreads. So have your own lunchbox at your desk, which you don't share with others, preferably at a staggered time. These are all practical things which companies can work out. Finally, there is increasing evidence that COVID can spread by the airborne route. And that is an unfortunate disaster, because most of us in large companies would work in air-conditioned setups, because the weather being what it is in most parts of India. So if you are working in an air-conditioned setup, then you have to ensure adequate ventilation. You have to make sure that your engineers make sure that the air is exchanged an adequate number of times per hour. There are standards for these which are readily available. The easy and simple thing to do is to open the windows or to ensure adequate ventilation. For instance, I practice in an air-conditioned office where COVID patients come to see me. I have not closed the door of my room for the last 1 year because I don't want it to be a contained setup. Ventilation always encourages dispersal. So it's largely person to person within 2 meters, and to a smaller extent, airborne within closed air-conditioned spaces. And that is why we would encourage companies to take as much of their work outside. When you're outdoors, natural ventilation fixes the problem. It eliminates airborne transmission. These are just some of the basic concepts which you have learned over the last year or so.
So, Dr. Gopal, what about companies focusing on testing in their campuses, or with a rapid antigen or RT-PCR, things like that? How valid is it? How long do you think it lasts? And finally, these particles you spoke about, which are in the air, how long do they actually last in the air?
Yeah, they can last for up to 24 hours, depending upon the adequacy of ventilation. If ventilation is good, air is changed frequently, much shorter periods of time. But a completely closed, still room with just a split AC in the corner, up to 24 hours, they can remain viable. So this is really a serious issue which industry needs to address. Regarding your question on testing, testing is the next tier of protection. Because remember, there are two facts about the test. First of all, a test is only 2/3 sensitive. In other words, if you test 3 people, you will only pick up 2, even though all 3 of them have the virus. So it's not a sensitive way of diagnosing or picking up COVID. Secondly, it is expensive. These tests cost money. Even if you do rapid antigen tests, testing the whole population like they do in the IPL bubbles once a day or once every other day costs a lot of money. And irrespective of whether you test positive or not, you got to follow the rules. You got to mask up, you got to stay 2 meters away, you got to ventilate. So that is the basic layer of protection which all levels of industry, education, etc. need to follow. Testing is the next level which you could implement.
Great. There is this announcement about availability of vaccines for anyone above the age of 18 from the 1st of May. And in your view, what is this going to do? How positive is it? Based on your own knowledge, how do you think this will be actually delivered across the country? And do you believe that over the next 2 or 3 months, there will be enough vaccines available to enable this? And finally, also, will this become a protocol, just like we do our tetanus shots when kids are born, to actually give them a COVID shot at the time of birth itself? Is that where we are headed?
Okay, so one by one, yes, I think it's definitely a step in the right direction, moving towards universal vaccination. Number 2, will it work? I hope so. I am sure it will reduce hospitalizations and deaths. Will it chop the pandemic in half? Will it just flatten the curve? Personally, I don't think so. And the reason for that is largely scientific. The vaccines we have are all based on last year's virus. The viruses that you have circulating, which you read about in the papers, the Bengal mutant, the Maharashtra mutant, they are all new. We don't know whether the vaccines work against these mutants. Chances are no. Personally, I have seen many patients who present with mild to moderate disease after 2 doses of vaccine. Many patients. nobody I have seen has been hospitalized or had serious disease after full vaccination, but they don't prevent mild to moderate disease. And that's something science, the government accepts as well. So yes, it's a step in the right direction. How they're going to work out the finances is a major issue, the state versus center versus private healthcare, etc. But it's certainly a step in the right direction. And the move to import any vaccine which is licensed abroad is also right. Last year, the vaccines, the government said, no, we won't take Pfizer, we won't take Moderna because they have not been tried in India. But that doesn't hold water anymore. We are in an emergency. We need all the help we can get. So authorizing use of those vaccines is a step in the right direction. Perhaps it should have been done several months earlier.
Excellent. Do you think there will now also be a wave 3, and how should industry prepare?
There will be periodic waves of COVID. COVID is going to be with us. This guest is here to stay. You can check out anytime you like, but you can never leave. You know, you've heard that song. So this is here to stay. How often COVID is going to come? Very difficult to say. See, if you look at influenza, which is the closest cousin of COVID, it comes once a year annually. It sharply comes in November, December, January in Western countries where they have a sharp winter. It's related to the rainy seasons in India. For instance, in Kerala, you will see peaks in May, June, July after the monsoons. In Tamil Nadu here, we would see peaks immediately after our northeast monsoon. So you're going to have an annual wave. It's going to be here to stay. It's going to be mutating slightly so that the previous year's vaccines won't work. So provided you take your vaccine every year, you will gradually build up immunity over a period of time. It's a controllable or manageable situation rather than a disaster that is likely to happen in the next month or so with the second wave.
So there are a lot of more questions coming from the audience on vaccine. One question is, what if I don't take my second dose on time? Is there any risk if I delay it and take it a little later?
No, there is a risk. One dose does not protect you. On exactly at 4 weeks, please take your second dose. If for some emergency you can't go as soon as you can. Just don't delay that dose. That suggestion to hold off on the second dose isn't valid anymore when you're seeing such a high rate of a second week over the country.
And in terms of availability of vaccines, if you have taken first shot as one vaccine and the second shot is not available theoretically at the point of time you have taken, can you mix and take the other one? These days, there is a discussion also taking place with Moderna and Pfizer on cocktails of vaccines. Any theories on that?
Yeah, whatever I say is theory. If the same vaccine is available, take it. If it's not available, something else is available, take it. Theoretically, there should not be harm from that approach. Whether it will work as good as 2 doses of the same vaccine, we don't know. There are trials ongoing for all this. We will know all this only next year, which is too late for this year. Common sense standpoint, take whatever you have. If you miss your second dose, take it as soon as you remember, as soon as you can, whatever is available.
And Dr. Gopal, as a renowned doctor who has seen many cases of this kind, have you actually seen any large-scale side effects of any of these vaccines? Can you give comfort to this audience?
Personally, I have never encountered a patient with a major side effect from the vaccine. However, I have to tell you that the surveillance system in India is inadequate. You are supposed to track a patient who has been vaccinated for 4 weeks after the vaccine, questioning for side effects. There has to be active surveillance. Somebody needs to phone call and check, are you okay, any side effects? And passive surveillance. The patient reports back saying, I have problem X, Y, and Z. That does not happen in India. I can tell you, I've had 2 doses of vaccine. Nobody called me afterwards to ask me how I was. So if you ask me, are you seeing blood clots in Indian patients, the so-called the blood clot issue with the Covishield vaccine? No, I haven't seen it. But then who has looked for it systematically? All countries that have looked for it systematically, Europe, UK, US, clearly say that there is a small risk of blood clots after these vaccines. And the risk is tiny. The risk of dying from COVID is 1%, right? Whereas the risk of a blood clot from a vaccine is 1 in a million or less. So there's absolutely no reason for you not to take a vaccine on that account. Every single vaccine known to man has rare side effects. And in the middle of an epidemic, if you don't take your vaccine for worry about a theoretical rare side effect, that is downright foolish. So please take your vaccines. Don't worry about side effects. Obviously, after taking a vaccine, you have some symptom, report to your doctor. That's important.
That's very clear. Dr. Gopal, there is also a question on your advice for small children as well as pregnant and women and nursing mothers. How should they avoid this disease and what should they do around vaccines?
The rules for avoidance are the same. 2 meters distancing, masking, those are the same. Those don't change. Children actually never have serious problems with COVID. There is a rare immunologic syndrome in children which comes on 4 weeks after they get infected. Very rare compared to COVID per se. So children actually do the best with COVID. It comes and it goes. A lot of the time they're asymptomatic, so not a concern. Pregnant women, as of May 1st, will be eligible to take the vaccine in India. We recommend that all pregnant women get vaccinated in the last part of pregnancy, in the third part, the last trimester of pregnancy, because theoretically any vaccine early in pregnancy can affect the mother and the growing baby. So we don't recommend it early in pregnancy, but late in pregnancy, yes, because pregnancy is a risk factor for adverse outcomes. Nursing mothers, no problem. Go ahead, absolutely safe.
So from all that you have said, it looks like very clearly you are saying that this is an unwanted guest that you should not welcome into your office space or into your home or whatever. And the most important advice, therefore, is to get your vaccines, practice your masking and other things. So, despite everything being seen and experienced, we still have a section of non-believers in the seriousness of the situation. People still don't mask or socially distance, and many are not really taking the vaccine. I hope that will change from 1st of May. How can we work with the medical fraternity to augment all your selfless efforts?
So what you could do is, every company head here could have a rule saying, if you don't have your mask on, security won't let you into the office. If we catch you with your mask off at work, you will be deducted X percentage of your salary, just for saying. If you don't take a vaccine and you're a candidate for a vaccine, say you're over 45 right now, and you haven't had your vaccine, you will not get your bonus or your incentive for that month. I'm sure there are a lot of things which you as industry could do to encourage people to follow COVID appropriate behavior. And there are precedents for all of these things. Over the years, we've had epidemics of other diseases, influenza, for instance. In the West, many hospitals mandate that healthcare workers take a flu shot before they come to work, because nothing may happen to them, but they will spread it to their vulnerable patients. So all of this has a sound legal backing. You don't need to worry about somebody taking you to court if you introduce these rules and regulations.
And what is the best kind of vaccine or rather mask that you would recommend that people use? Because we see all kinds these days. Which is the best one that we should actually be recommending?
For laypersons, just wear a cloth mask. Try to get a triple layer mask. Just 3 layers of cloth stitched together crudely, or I'm sure all these commercial shops offer triple layer. Look for that word triple layer, because the inner layer keeps the COVID, filters out the COVID. The middle layer protects the sweat, etc., from striking through, and the outer layer protects you from outside. It has to be a triple layer mask. If you can't get hold of those, any medical mask which you can get in a pharmacy is entirely appropriate. The N95 masks are unnecessary for public people. That is only for aerosol generating procedures. And if you actually wear them right, then you can't breathe in them for long periods of time. I get short of breath when I stay within the COVID ICU for more than half an hour, because they're very tight fitting and you got to really draw in breath. So that's really not appropriate for the public. Wrong one, Keshav. That's the wrong one. Don't do that, folks. Okay. That's the wrong one. Just wear a triple layer mask. Okay.
Excellent. Many companies are planning to actually start vaccination camps in their own offices. Some are also going to have quarantine centers in their own offices. What are the considerations that we must bear in mind while we do this?
I think vaccinations are perfectly appropriate. Always have a medical health professional with access to an ambulance handy, so that if there is a rare case of allergy or somebody blacks out or somebody has a true vaccine side effects, they can immediately be transported to a hospital. So have a tie-up with medical professionals where that can happen. That can happen anytime an injection is administered outside a medical setting. This is a theoretical risk that you can have a side effect. So have a backup for emergencies. That's the only thing you need to do. Roll out the vaccine by all means. Make sure you get permission for it beforehand, but have a tie-up or a backup ambulance, nurse, medical expert on standby for side effects.
Excellent. And I'm also assuming that when you spoke about masks, you also recommend that even homemade masks, as long as they have the triple layer, are fine.
Absolutely. See, we live in a huge country, 1.3, 1.4 billion people. We can't do exotic imported stuff. Just whatever works is good. You know, a mask is better than, I've seen people put their dhotis on, put the dupatta, put the pallu of the sari. Not recommended, but better than nothing.
So, Dr. Gopal, one final question, because I think, we are very respectful of your time as well as all the other people's time here. I know you have to get back to your patients, but how long do you think we should prepare for as far as this particular pandemic is concerned? And is this something that is, we're going to live with for the next 2 years at least, which means masking, washing hands, distancing is something we have to practice for the next few years?
I would think forever. Now, I'm standing out on a limb when I say that, but I don't think these viruses are going to go away. In the history of infectious diseases, there has never been a virus which has gone away. We have had influenza for more than 100 years now. It certainly hasn't gone away. And COVID and its related viruses are not going to go away. So you're going to have to live with this virus, get a better vaccine out, get more people vaccinated, but yet continue to do all these preventive measures forever, because industry doesn't want to see people off sick. Obviously, your productivity will go down if that happens. So you're going to have to follow these rules forever. That is what I expect based upon the history of similar infectious diseases.
Before I let you go, I have one important question, which I think would be very useful for the audience here. These people are used to traveling a lot, and for the last 1 year or so, they've been locked up at home.
But, me too. I'm stuck. Vacation canceled.
Yeah,
so
yes. But what is also happening is our client environments are starting to open up in the West. Because by May or June we'll have the whole of US vaccinated. We'll see a lot of progress in Europe, and therefore clients will want us to start traveling. First of all, what is your recommendation there? Second is, if we have to travel for emergency reasons, what are the precautions we must take?
The first thing I would say is something called Zoom. I didn't know what Zoom was till COVID came out. So try to do everything on Zoom. Secondly, if you have to travel, you travel and you follow whatever I said. You distance. You don't have somebody on the middle seat, sit in a corner seat or the window seat. It turns out that planes are actually among the safer places because the air handling unit of the aircraft is at a very high level. Actually, a plane is far safer than sitting in an air-conditioned office where there are many people sitting around. So the plane itself is safe. The issue is the place where you check in, the security check, the crowds as you go into the aircraft, taking off your mask when they serve you food on the plane. These are the situations where you might potentially pick up COVID. So if you have to travel and travel is allowed, please go ahead and do so with masking, social distancing, vaccination, and following the rules of the country where you're going. That is most important. Usually they will ask for a negative PCR or for quarantine based on what you're going. If you have to travel to keep your business alive, you have to travel. So there's no option. Just follow the rules and get on with it.
Dr. Gopal, I keep saying that I'll let you go, but every now and then some new question comes in, and
I'm free till 1 o'clock, Keshav. So
very good, very good. So I have one more question. What are the protocols people should follow when they attend functions like weddings, engagement ceremonies, things like that? One. Second thing is, how often should one change a mask? And even this triple cloth mask that you spoke about, when should it be washed and reused?
Yeah, the first question is easy to answer. Cancel. This is not the time to have a wedding engagement. This is not the time to have a large marriage function. The problem is in social occasions, one, you can't enforce anything, right? People are happy. And when you're happy, you don't follow the rules. You're not disciplined. Nobody is checking to see if you're following the rules. Secondly, when you go to a wedding reception where you have not seen a long lost relation for a long time, are you going to leave your mask on? You want to see how that person looks, how you're looking, with your lipstick on, whatever. It's not human nature to leave masks on in social occasions, right? And you got to take it off anyway when you sit in a large group to eat. So social occasions are really a no-no, right? That is my personal opinion. If you have to attend, hold it outdoors where natural ventilation reduces the risk. Enforce masking, avoid meals because you got to take your mask off to have a meal. If you can do all this, yes. And the smaller the meeting or the fewer the number of people, yes. So that was your first question. Your second question was how often should a mask be used? I think it depends on the usage of the mask. If it's hot and outdoors and you're sweating and you're using it a lot, obviously daily at least. Either dispose of it or have it washed in soap and water and reuse. But if you're using it sparingly, you're alone most of the time, you just use it to step in and out, then it could be used longer. So there's no fixed answer till it stops working or visibly dirty or is soiled.
So some doctors, including you, had recently mentioned to me that some of the cases that have been seen recently seem to have also happened when people went for their vaccination. It means that either they had a cup of tea or drank some water or something. And therefore, any advice there in terms of what is the protocol to follow when we actually go for the vaccination itself?
Yeah, so when you go for a vaccine, that's like a small mini banquet, right? A small mini wedding reception because they offer you stuff to eat and drink. First principle is avoid the stuff to eat and drink, or if you have to do it, quickly remove your mask, quickly eat and drink and put it back on. Secondly, these are congregate settings, especially if they are air conditioned and indoors. So all that I said applies. Stay 2 meters away, wear your mask, etc. So going for vaccine is not exactly a safe thing to do, but it's essential. That is the only way around it. The government has no plans to introduce door-to-door vaccination, which is the ideal way to do it. The issue with door-to-door vaccination is that if somebody gets a shot at home and they collapse, then where is the medical backup? So that is the concern they have. That's a valid concern. But if you can get over that, home vaccination is actually far safer. So till that period of time, consider a trip to the vaccine center as a potentially risky thing to do, but unavoidable. Far safer to take your vaccine than not go in at all due to fear.
Sure. Dr. Gopal, in terms of corporates, what can we do beyond what we are doing for our own people and our companies in terms of vaccination and some of the safe practices in order to help government and society in general, in your view? Today, in a discussion with municipality people and police here in Maharashtra, we heard that the biggest issue is really around supply of oxygen, not capacity of oxygen. It is about remdesivir injections and also potentially something called Virafed. Is there something that we can do in areas that you want to recommend?
Yeah, I think oxygen is really a critical need. Oxygen is the lifesaver in COVID. All you need is oxygen. Your immune system takes care of the rest most of the time. So I think corporates could get involved in a big way to ensure that especially facilities for the poor, government hospitals, charity hospitals, smaller hospitals that look after COVID patients who can't necessarily afford care, don't run out of oxygen. If corporates could help either set up oxygen plants or distribute oxygen to these centers, that would be a major service to the community that you could potentially do. Because you can't treat COVID without oxygen. That's absolutely true. The medications are really borderline. If I don't have remdesivir, I can save your life. And the third drug you mentioned is more or less useless. But without oxygen, I can't save your life. So that is something you need to focus on.
So what you're saying is we could actually step in and actually create permanent long-term capacities for oxygen in a lot of government hospitals, which actually will help with the longer-term waves.
Yeah, sure. I think this was done for ventilators. We now have indigenously made ventilators, which are far cheaper and as good as imported ventilators. They've done a very good job in the ventilator area. I'm sure the same thing could be done for oxygen.
Now, everybody is also looking to donate material, equipment, and things like that to various forces in order to manage this crisis because everyone wants to positively help. But what we are also hearing is a lot of these donations being asked for are also quite useless, right? What are the areas that we should concentrate on beyond oxygen, as you said?
Number one is masks. Number two is personal protective equipment. Number three is appropriate general medical help. For instance, when a COVID patient gets admitted to the hospital, there are 3 or 4 essential medicines. We give a medicine to prevent blood clot called low molecular weight heparin. We give a steroid called dexamethasone. These are essential medications for COVID. you will need gloves, you will need intravenous medical supplies, you will need clean air. So all these things, you just pump in money into the healthcare system in whatever way corporates can. It could be a corporate sponsored hospital, it could be helping a government hospital, it could be a tie-up with a corporate chain of hospitals, whatever works for you. But these are ways. There is always money needed. There are just no beds. For instance, if you want me to admit in a hospital where I work, Apollo, I have to search for a bed. I don't have a bed. It's full up. So helping out, sponsoring beds, sponsoring care is always something that is welcome in terms of COVID care.
So my final question before I let you go now is, when should a patient actually look for a bed in a hospital? Because we find that, quite often people want to rush to a hospital, and often you have said that some of them don't need hospitalization. So can you give us advice around that, because we can circulate it inside our companies?
Yeah, the danger signs that require immediate rushing to a hospital are breathing difficulty, or if you measure your oxygen levels at home and that number is 94 or less, right? Or any other serious symptoms, say chest pain, fainting. Obviously, these are all serious symptoms. Go into a hospital. But 99% of patients with COVID won't have these symptoms. They will have some loss of smell, some cough, some running nose, some fever. Just get in touch with your doctor. This could be over the phone, it could be in person, it could be over WhatsApp, and they will guide you as what is to be done. Again, 99% of those 99% will settle down with simple things like paracetamol, cough suppressants, or an inhaler. So getting proper advice is most important for most COVID. There is a lot of mistreatment, Most of my work is spent correcting errors of others who are not well informed about COVID. So go to a good doctor. That's much more important than rushing to a hospital.
Thank you, Dr. Gopal. That has been really enlightening for all of us. I think we have lots of very useful information. I know how busy you are, and therefore we'll let you go early. On behalf of NASSCOM and the tech industry, I sincerely thank you for your time. And once again, congratulate and thank you for all the good work you and all your colleagues are doing for us. Thank you very much.
Thank you.
And thank you all for attending.